Hey everyone, and welcome. It's Dr. Mache, and we are on Facebook Live, Ask Dr. Mache. And tonight we're talking about 5 tips to help you sleep better. So I want to welcome you here, and let's get started by talking about something that's very important, and that is the area of sleep, particularly at the time of menopause. Because it turns out that about 2 out of 3 women in and around menopause are having difficulty with sleeping. Now that's a lot of women. And as a matter of fact, sleep is probably one of the top 3 to 4 things that women ask me about, either as patients when I see them in my office, or when I do coaching and mentoring of women from around the country, around the world actually. I get questions about sleep because it's so disruptive. And of course, sleep is a lot more than just being tired. Sleep can contribute to depression and anxiety, and it can contribute to high blood pressure and diabetes. Lack of sleep can increase your appetite and increase weight gain, and sleep can contribute to poor work and poor work ability, not showing up for work, being tired, and so forth. And so there's a lot of things that sleep can do that really is negative to your general weight, to your general life, and your well-being. So I want to talk about 5 tips that you can do to help you in terms of your the things that you're doing. Katrina, thank you very much for sharing the video. I hope that all of you will share the video because we want to get as many people as we can. My goal is to help you figure it out so you won't have to tough it out. And if you like the page, I'll also be able to send you Facebook Live notices when I do these at other times during the week, because although I have a scheduled one that I try to do each Thursday at 9 o'clock Eastern, there are other things that come up, and I want to now begin to do more of them throughout the week as I come across stuff that I think will really be of interest to you. Amanda, thank you very much for sharing with your friends. Well, one of the things that will help, 5 tips, let's talk about the first one. One of them is to get some control over your anxiety and your depression and the stress that you're under, because stress is a very big issue in and around menopause, anxiety and depression, sadness, and so forth. And so I do want to talk about something that I think is very important, and that is lowering that stress, lowering the tension in your life. One of the areas I want to talk about, and I see Janet Miller, thank you so much for sharing. I really appreciate it. One of the things that's very important is to try and lower that stress and anxiety and sadness if you're feeling it. And one of the best ways to do that is with mindfulness. And I'll be sending out an email very shortly about something that you can do to lower stress. I'm going to teach how you can actually learn how to meditate in just 3 minutes. I've got a technique to help you that I think will be very interesting for you. So if you join me, if you sign up on drmache.com for any of my things so that I can send you things, you will get emails from me each week, several each week, that are educational, that are informational, that will send you stuff. So number 1 is try and increase your mindfulness. Try to learn to do meditation. There's a lot of techniques, and boy, can that be helpful in terms of improving the quality of your life. The second thing has to do with eating in the time that you choose to eat. One of the things that happens is so many of us are working late and later that by the time we get around to eating, it's like 7:30, 8 o'clock, 9 o'clock. We eat a big meal because we're hungry, we've been out all day, we get home, we're just famished, and then we eat this big meal and then we try to go to sleep. And so what that does is it increases difficulty with sleeping because it's all that food in your stomach is pushing up on your diaphragm and causing difficulty. So you're much better off if you can try to eat your larger meal, believe it or not, at noontime, and try to eat your smaller, lighter meal more at bedtime, and try to limit how late you eat. By 7 o'clock, you should be done with everything. And of course, what you want to avoid in that meal is caffeinated drinks, lots of sugars, and things that can contribute to keeping you up even longer. Another tip I want to give you is for sensitive bladder. I will tell you that one of the things that happens that isn't talked about a lot is sensitive bladder. At some point, if it's of interest to you, and I do hope you will share with me what topics you want, because this is for you, and I want to try and answer the questions that will be most helpful to you. And so sensitive bladder is a big issue. And the thing about sensitive bladder that I want to share with you here is that it's so embarrassing to women to have a sensitive bladder where they're going to the bathroom. You go, between here and you go to work, and you know every mall, and you know every bathroom stop in the mall, you know where to go everywhere. Well, that's a very common thing that affects more than half of women. And it's not only women in menopause or, over 40. There's a substantial percentage of women that either can't control urine the way they want, or they have to go, they have urgency, and they just can't get there. And so what I want to say is, it's very important to share this with your healthcare provider, because the average woman will wait 7 years, 5 to 7 years, before she will tell anybody that she's having a problem. And that means that she has suffered for between 5 and 7 years, really unnecessarily, because there's just so many things that can be done now, and you don't have to have a big operation. You can actually have things done as outpatients. You can have all kinds of treatments. There's a whole discussion I could give you on the treatment of sensitive bladder, but there's physical therapy that can be done, so forth. But all of this improves the quality of your sleep, is why we're talking about it here, because sleep gets so disrupted by the sensitive bladder. And so don't wait 5 to 7 years. Talk to your doctor. So mindfulness, number 1. Number 2, eating earlier and avoiding caffeinated things that are bad and keeping you up. And the third is controlling a sensitive bladder. The fourth one is hot flashes. Boy, we have so much issues with hot flashes. And when I talked about hot flashes on Facebook Live, we had about 1,600 women joined in on that discussion. It was very stimulating, very dynamic. And because of that, I have developed a hot flash rescue kit. And if you went to hotflashrescuekit.com, I've put together a comprehensive program for you, hotflashrescuekit.com. You could check that out if it's of interest to you. But boy, you would get a lot of information there to go in and talk about with your doctor. But controlling hot flashes is not something that's just a nuisance. As you would find out in hotflashrescuekit.com, what you would find out is that hot flashes can be a sign that there's more serious things going on with you. They're disruptive. They can even be equated with heart disease and other conditions. Boy, it's something you need to know about, but they can really mess with your sleep. And finally, the last one is sleep apnea, number 5. Sleep apnea is big problem. It affects women more than men. And what happens is the soft palate, the top of your throat, actually goes back into your throat and blocks the airway. So if you are someone, or if you sleep with someone who is really snoring like crazy, someone who is waking up and they're not breathing for a moment, like that, those kinds of things could be a sign of sleep apnea, and that's very common. And the thing about sleep apnea is not just it's messing with your snoozing, it's also putting you at risk for sudden death from heart attack and from other things. These are potentially serious consequences that are affecting your sleep. And that's why I want you to realize these are tips to help you get the kind of information that will make it easier for you to get a good night's sleep. If you have some questions now or things that you'd like to talk about, I'm happy to answer your questions. That's what I'm here for. As I tell my story to you, why am I so passionate about helping you figure it out so you won't have to tough it out? It's a very straightforward story. After a Women's Health Initiative, the WHI study came out in 2002 saying, incorrectly I might say, incorrectly, that estrogen increased the risk of breast cancer and heart disease and so forth. My wife had surgery that threw her into early menopause, and she needed hormone therapy, and she couldn't get doctors that wanted to treat her. They were very resistant to treating her. And so I really, at that time, was one of the world's top people in the infertility arena. I did one of the first in vitro fertilizations in the country. Even helped gorillas get pregnant at the zoo. But I switched over, as I say, I used to do sperm to term. I shifted over to womb to tomb because I wanted to try and figure this out so she wouldn't have to tough it out. And it ended up in the publication of my best-selling book called The Estrogen Window, which really talks about this hormone story in a way that explains there's a time frame for taking hormones that's really very helpful. Well, I am happy, Kathy, for being here, and I'm delighted to be able to help you. Thank you for joining. Now, Janet says that she is 54 and still spotting. Is that normal for my age? Well, 54 is within, menopause can happen as late as 60. Can you believe that? For some women, they're having regular cycles. I saw a patient not very long ago, and she was coming in, and she was 57 years old and still having regular periods. I said, well, just out of curiosity, when did your mother go through menopause? And she said she was 60. Well, that happens. In the bell-shaped curve of things, somebody's at the other end of the curve. So if you're still spotting, if it's happening just willy-nilly at odd times, if there's heavy bleeding, if there's something that doesn't seem normal to you, check it out with your healthcare provider because it could be a sign of something. But a little bit of staining or spotting at 54 per se is not necessarily problematic. But like I said, it all depends on your particular situation. So if it's just staining periodically, okay, but when you go in for your next exam, talk about that with your healthcare provider and let them see if there's anything the matter. It can be easily evaluated, and they can do it by either checking the lining of the uterus by ultrasound, which is, a little probe that they put into the vaginal canal, and it can look with sound waves and see the thickness of the lining of the uterus, or sometimes they will check it with a very thin, what's called a endometrial biopsy, which it's like smaller than a small thin pencil. It goes in the uterus, it causes a kind of an ouch for about a moment, then about 30 seconds of cramps, and then some tissue is taken out, sent to pathology, and that'll tell if it's okay or not with certainty, so you don't have to worry. So check that out next time you do go in. Anyway, as I was saying earlier about my book, The Estrogen Window, it explains that if estrogen hormones are taken at the right time in your estrogen window, that it can actually lower your risk of breast cancer, lower your risk of heart disease, even lower the risk of dementia, osteoporosis, colon cancer, boy, a whole lot more. But in terms of sleep, I have a whole section in there about menopause and about hormones and sleep. And of course, I realize that not everyone wants to take hormones, even though there's a way to take them that is quite safe. But for some women, they still can't or won't take them. And I do talk about all the alternatives. And as a matter of fact, just a couple of weeks ago, I did a whole Facebook Live on alternatives to hormone therapy, and we talked about a whole host of things that women can do for sleep, for other things. And last week we talked about, is menopause making me fat? So you can always go back on my Menopause Magazine on Facebook, and you can see the Facebook Lives. I post them there afterwards so that people can go back if they want. And there's so much information in there. And another thing, if you really want to know how much menopause is affecting you, you can go to menopausequiz.com, menopausequiz.com, and if you go there, you can take a 2-minute free quiz, and it will tell you how much impact your symptoms are having on your experience. It will tell you some tips. You'll get some tips afterwards. So take up on this free offer. It's menopausequiz.com. Pretty easy to remember, but there it is just in case. And also, I've put for you at the top, up where we list the name here, you can go back. And I've given you a URL because one of the things that will help you tease out your sleep problems is having a sleep diary. If you've never seen it, some of you may remember, you may have taken a basal body temperature, you took some kind of a temperature. Well, this isn't about your temperature, but it looks across the month. And if you go to drmache.com, sleep-landing, and it's written up above here. I've put it there for you. Go there, you'll get a free sleep diary. And what it does is it allows you to put your symptoms down and show when they happen. It talks about what you've eaten. Of course, when you go to sleep, you want to avoid if you're a smoker. I hope you're not a smoker, but if you are a smoker, I hope you're not doing it near bedtime, but smoking and sleeping doesn't go together too well. Caffeinated things, alcohol, you go out, you have those late dinners I talked about, you have a few drinks. Alcohol may make you sleepy, but it doesn't help you sleep. You get up to pee afterwards. It causes people to wake up actually earlier. So this is a big issue. So alcohol, not good for sleep. And so check out the sleep diary. Again, it's at drmache.com/sleep-landing. Other questions that you have, and I'd be happy to answer them while we're here. We still have a little bit of time left, and I want to offer you as much opportunity as I can here, because I think that it's important to get the information so that you can become a partner in your health care. Because so many times you go to the doctor, and how long do you get when you're in there? You're like 10 minutes. A lot of visits are 8 minutes. If you're 15 minutes, it already seems like a long time. But believe me, you're not going to be in long enough to change your zip code. I'm telling you, you're not going to have to forward your mail. You're going to be in and out. And that's because there's just no time in the office. So here you're getting an opportunity with one of the country's leading menopause experts, and you're getting the opportunity to ask questions that you don't even get a chance to ask when you go to visit your healthcare provider. So let's talk about stuff that's on your mind, and I'll be happy to try and help you with the information so you can figure it out and not have to tough it out. Other questions you'd like to ask? Sleep is such a big issue. I'm surprised that there aren't more questions, but maybe everyone's already sleeping. It's late in the East Coast where I am. So I was so worried that we wouldn't be able to meet tonight because just about an hour ago there was such a big lightning and thunderstorm that I thought, oh my goodness, I don't even know if there's going to be internet or not. So, all right. Well, I'll remind you again that if you are interested, take that menopause quiz. It's a 2-minute long quiz. That's all it is. It's interactive, and it will tell you what's going on with your symptoms. It covers the major symptoms of menopause. You rate it, you see how big an impact it's having. It will give you a score, and it will give you feedback, and it only takes 2 minutes to take. And then there's the URL that's at the top of this Facebook Live. It's called drmache.com/sleep-landing, LANDING. And there you can get the free sleep diary and take advantage of that, because if you are really troubled with sleep, And believe me, it's about 2/3 of women are having difficulty sleeping. And for a percentage of those, the sleep is really a major impact in their life. It's disruptive for them in a major way. And it's not only the fact that they're tired. As I said, 5% of people have fallen asleep at the wheel while driving in the last month, if you look at surveys by the National Sleep Foundation. And if you realize how tired people are and exhausted, that's a big deal. So let's review those 5 steps that I talked about. First, the mindfulness to help you lower your stress, to help you lower the anxiety, and if you're having sadness, and hopefully not depression, but if you're feeling sad, which is common around the time of menopause, mindfulness is really important. And if you've signed up with me, you're going to get an email very shortly about ways to, 3 minutes to help you learn how to meditate. It's a really cool, and it's very quick, and it's something that I learned, and I want to pass it on to you. And the second is that you want to have eating at a reasonable hour. If you haven't eaten dinner tonight, tonight was a late night in terms of dinner for me, so we had an omelet. That's what we had for dinner because I don't want to eat heavy and go to bed. And that's a real nice meal that's filling and yet not too heavy. Then avoiding the caffeinated things, smoking, and so forth. The next thing is sensitive bladder. Don't wait 5 to 7 years like the average woman does to get treatment for it. Talk about your doctor. 5 to 7 years before the average woman even mentions it to her healthcare provider. Don't be that woman. The next one is to treat your hot flashes. There's just so many things. Every one of these topics we can make into an entire discussion. And finally, sleep apnea. If there's heavy snoring, waking up at night with gasping or stop breathing, any of those things. Okay, well then we will wrap up for this week's Facebook Live. Thanks for spending time with me. Please like the page so that you will get notices of other things that are going on. And if you go on my website, drmache.com/blog, you'll get a lot of interesting information. I posted something today about glucosamine, which is commonly tied into arthritis. But boy, if you go there, you will find out it can cause you some other symptoms that are as bad or worse than your arthritis, and you need to be aware of it and what you can do to avoid that problem. And again, go to the URL drmache.com/sleep-landing. Okay, have a wonderful evening. If you have questions, you can put them in ahead of time at askdrmache.com. But thanks for joining me this evening. Remember, it's better to stay well than to get well. So stay well.